Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
I once wrote an article about how vitamin D was improving people's lifespan and health span. Now, lifespan, everybody knows, it's how long you live, but health span is how long you stay healthy. And there's been a huge amount of research on vitamin D coming out over the past several decades, but recently, I mean, it's just hit the ground running. It's just amazing. And I want to go over that. Now, we've done a number of episodes in these podcasts at Invite Health on vitamin D, how it seems to improve survival in cancer patients, other podcasts on how it's very important for the immune system when you're fighting a virus, for instance, to help marshal your immune cells to do the right thing for you to protect you from infections while helping prevent your own immune system from attacking your organs and tissues such as your lungs. I'll go into that a little bit later in this episode. In any event, I want to discuss some of the new data that's come out in the past several weeks on vitamin D because it's rather amazing, actually, and I really think that almost everyone can get value from taking a vitamin D supplement. Just make sure it's a really high quality. And also another tip, D3, cholecalciferol, seems to be superior to D2, which is ergocalciferol. In any event, hi, my name is Jerry Hickey. I'm a pharmacist. I've also studied nutrition, and I'm the Senior Scientific Officer over here at Invite Health. And I'd like to talk to you today about all these new findings on vitamin D and how it's really come to a head at this point, that it's just a magnificent, very safe supplement. And think about it. It's very cost effective. Vitamin D is inexpensive. It's very safe. And it seems to be unbelievably protective. So subscribe, please subscribe to the episode podcasts. Please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health, and all of the information on today's episode will be linked in the episode description, and you can visit invitehealth.com and just scroll down halfway. That's our loading page. Scroll down halfway, and you'll see a big icon for podcast. Click on that, and you'll get our podcast. I think on the website now we have about 270 podcasts. So let's get going. Not very long ago, in December 21st to be exact, there was a very important letter sent out to world governments around the globe. It was at that point 120 health and science and medical experts from the United States and the UK and Europe say there's clear evidence that vitamin D reduces COVID-19 infections in the first place, but also helps keep you out of the hospital and helps prevent you from dying. So it's a group of scientists that are calling for immediate, widespread, increased vitamin D intakes. Most of the signatories to the letter, they declare they're personally taking at least 4,000 units a day. Now, they cite new mechanisms specific to SARS-CoV-2, the coronavirus, that are now very well understood. So they said with the body of evidence, including a whole bunch of different biological mechanisms, showing how vitamin D directly influences your outcome with COVID-19, the infection. So the virus is called SARS-CoV-2. It's a coronavirus, and the infection itself is called COVID-19. So they said there's more than 70 studies showing that higher levels of vitamin D in the blood connected with a lower risk of getting an infection. I know Boston University did some of that research. And also that you have a lower risk of being hospitalized. In other words, if you got the virus, it wasn't as mean, it wasn't as dangerous, it wasn't as fulminant. Also, keeping you out of the intensive care unit and preventing death, which is ultimately what we'd all like. So there's a lot of info coming out, and it's, according to them, confirmed recently by published randomized controlled human clinical trials. Now, let me give you a couple of names on this because it's important. The main organizers of this campaign, and this letter sent to governments around the world, Carl Flegler, he's in the U.S., Dr. Carl Flegler, and Dr. Gareth Davies, he's in the U.K. Now, they're both involved with artificial intelligence and data science, but also medicine. And like I said, there's a growing list of 120 signatories, some people in politics, but there's more than 100 medical doctors or PhDs or people who are both a medical doctor and a PhD. There's more than 60 professors and 2 British MPs. So this is, this carries weight. This carries weight. So, you know what? Let me give you a couple of those COVID-19 studies to begin with. But I didn't plan on this. I was going to do it later in the show, but I think, since we read that, let's go into some of these studies. Here's the Department of Internal Medicine, University of Heidelberg in Germany. It's in the journal Nutrients. It was last September, so pretty recently. And they wanted to see, hey, what about vitamin D, the level of vitamin D in a person's blood? So they weren't just asking people, what did you eat or did you take a supplement? They were actually looking at the blood level and seeing how severe did the COVID-19 infection become. And what about survival? So it was 185 patients diagnosed with the coronavirus disease, COVID-19, and treated at the University of Heidelberg Medical Center. So their primary endpoint, that means what they're really looking for is did it keep you alive and did it prevent you from getting a serious infection like getting intubated with a mechanical ventilator? So that's what they're looking at. Now, they adjusted for people's age because we know the disease could be much more serious in people who are in their 80s than somebody in their 30s. They looked at the gender because it seems to be worse in a lot of men, but they looked at comorbidities too, like obesity and did they have diabetes, did they have lung diseases. And here's what they found. When they ruled all these things in, vitamin D deficiency, so that's really low blood levels, like, well below 30, higher risk of having a severe COVID infection, like winding up in the intensive care unit, winding up on oxygen, winding up with a mechanical ventilator. The major battle with COVID-19 in many people is fought in the lungs. They develop acute respiratory distress syndrome, where the lining of the lungs fills up with fluid, and these people can't breathe, and it's really seriously dangerous. And then you have that cytokine storm destroying the lungs. It's just a really bad situation. Once you're on a mechanical ventilator, and you're in the hospital for a significant amount of time, it's a very bad sign. It's a very scary sign. So they found that people with really low vitamin D had a much higher risk of winding up on a mechanical ventilator, winding up in an intensive care unit, and winding up dying, a 612% increased risk. That's for winding up with a serious disease. The risk of dying was 1,473% higher. I mean, I know it sounds crazy, but get on your vitamin D. So here's a report. It's a Dr. Joan Lappy. She's an associate dean for research. She's a professor in the College of Nursing at Creighton University. That's over in Omaha, Nebraska. She said cells in the body need an adequate amount of vitamin D to function efficiently and boost one's immune system. Now, that's true. You need adequate amounts. And vitamin D it's so important to the immune system that the immune system can actually activate vitamin D. So let me explain what that's all about. When a doctor tests your blood for vitamin D, they look at 25-hydroxycholecalciferol. That's what they're testing for. That's a storage form of vitamin D. It's not yet active. And you want to see that well above 30, 40, 50. I mean, like a beautiful level would be between like 50 and 60, 50 and 70. That's a beautiful blood level. You can't do much better than that. You really can't. So it still has to be activated. But normally we thought only your kidneys could activate vitamin D, but recently it's been found that most of your immune cells, if not all of them, can actually activate vitamin D, showing how important vitamin D is to our immune system. You need it for immune cells to function to kill a virus and also help kill a cancer cell, but you also need it to protect ourselves from our own immune system. Our immune system is a very powerful army, and if it turns on us, it's deadly. I mean, this is what happens with autoimmune diseases like systemic lupus erythematosus, where somebody's own immune system could be damaging their kidneys and their heart, just to give you an example. So vitamin D helps prevent your own immune system from turning on you when you have a virus, because that's what's happening with COVID-19. They get the virus in their lungs. It could flood the lungs with fluid. It inflames the lung. There's a backlash from the immune system. Then you have that so-called cytokine storm, where the immune system is releasing all of these chemicals that increase inflammation and call in more immune system soldiers, and then it destroys your lungs. So she said research shows that people with higher blood levels of vitamin D. Once again, we're not in these studies, we're not depending on people telling you how much vitamin D they take or what foods they eat, and then you figure out how much vitamin D they're getting. They're actually looking within their blood. So they said research shows that people with higher vitamin D blood levels have lower rates of COVID-19 infections and lower risk of contracting severe cases that can lead to hospitalization or death. This is Dr. Joan Lappy. So here's what she says. Dr. Lappy, it's a call to action. She recommends taking at least 2,000 international units of vitamin D a day, always take it with food, during the winter season. Now, you should do that for every winter because, sometimes even the flu could turn on you. She said the elderly, homebound individuals, and people who are obese are more vulnerable to vitamin D deficiency. Let's talk about that. So are diabetics, by the way. Why would a person who's obese be more prone to having a vitamin D deficiency, even if they take the supplement? Because the vitamin D gets trapped in fat cells and it's not available to tissues and organs like the brain, the bones, and the immune system to function. So it's very important for obese people to take even more vitamin D than other people do. And also homebound individuals, they're not getting any sun. You don't get sun in the winter anyway, but they're not getting any sun to make even a little bit of vitamin D. And the elderly, sometimes it's the way they eat, plus their skin is aged and it doesn't create vitamin D very effectively even if they get sufficient sun. So the elderly do tend to require more vitamin D. So let's go on. These are all important. And it shows you, especially in winter, vitamin D is so key to survival. Not just staying healthy, but survival, it seems. So let's look at some of the new stuff that came out. So I read you about that open letter to the world governments from 120 health professionals. That's from the end of December. So that's 2 months ago. Because right now, I'm recording this on February 17th. So here's a report that came out yesterday, February 16th. Vitamin D deficiency increases the risk of being hospitalized in older adults. So I'm just going to read you the report. Vitamin D deficiency increases the likelihood of being hospitalized and also how long you stay in the hospital, length of stay in the hospital, in people over the age of 60. This is a cross-sectional study of over 3,000 people. So there's previous studies, by the way. There's already a body of evidence. There's already an archive of evidence in human clinical trials published in medical journals that you have an increased risk of being hospitalized and being readmitted to a hospital after you've been finished, and nursing home admission, and even increased length of stay in the hospital if you lack vitamin D. And it's connected with diseases, like there's evidence that lacking vitamin D is involved with multiple sclerosis and chronic obstructive pulmonary diseases and infections. So they have evaluated data on 3,093 people over the age of 60. This is in Ireland, by the way. It's Trinity College and St. James Hospital in Dublin. And they found, there's no two ways about it, people low in vitamin D have a higher risk of being admitted to the emergency department and also being readmitted to a hospital, winding up in intensive care, and having a longer stay in the hospital. It's in the journal Nutrients right now. But here's two astounding reports that just came out recently. This is from February 10th. It's the German Cancer Research Center. When the German Cancer Research Center writes a report on vitamins, I really pay attention. These people know exactly what they're doing. And they're looking at 3 different meta-analyses looking at vitamin D and survival in cancer patients. Now, a meta-analysis is when hopefully really good researchers, in this case the German Cancer Research Center, so we know they're really good, go onto all these electronic websites that collate studies. And they download all the studies looking at vitamin D and cancer survival. And then they go through it and they throw away the poor studies, the poor results, the studies that look like they're biased or they're not well performed, or they didn't take certain things into account that they should have. So then they're left over with a large body of evidence from a whole bunch of different studies from all these different researchers and clinics and hospitals and academic research institutions, and it's a much larger body of patients. So they took 3 of those meta-analyses. If a meta-analysis is performed well, it proves something either works or it doesn't, because you have all these different studies, all these different researchers. It really means something. So they found that a supplement of vitamin D in cancer patients reduces their mortality rate. It reduces their risk of dying. And here's what they said. This blew me away, actually. It really did. If all Germans over the age of 50 were to take a vitamin D supplement, and mind you, they were only looking at 1,000 units, which is extremely safe, not expensive at all. You take it with food, get the D3 form, not the D2. The D3 seems to be superior. If all Germans over the age of 50 were to take a vitamin D supplement, up to 30,000 cancer deaths per year could possibly be avoided. Okay, in Germany alone, if every adult over the age of 50 took a vitamin D supplement, even just 1,000 units, 30,000 fewer people would die of cancer. Now, I've seen a lot of these studies, prostate cancer patients, breast cancer patients, and other cancers. And again, it comes up the same. If you have sufficient vitamin D in your blood, you have a better chance of surviving your cancer. So here's a second one, right down the same avenue. It's in the journal Nutrients. It's the Medical University of Vienna in Austria. And now they're looking at cancer patients again, and the severity of the cancer and survival of the cancer and vitamin D. And they said severe vitamin D deficiency is an independent contributor to being hospitalized with cancer and dying of cancer in people with critically ill cancers. So in other words, people with advanced cancer, if they're low in vitamin D, they're much more likely to wind up in the hospital, and they're also much more likely to die from the cancer. So it was a study looking at patients admitted to their hospital, the Medical University of Vienna in Austria. That was between the year 2014 and 2019. It was 341 patients. They published their findings in the journal Nutrients, and that's exactly what it said. I mean, it's clear cut. Severe vitamin D deficiency independently predicts if you're going to wind up in the hospital and die. I mean, it's just not good. So my recommendation, I get 2,400 units of vitamin D as a supplement every day, but you can safely in the winter especially take 4,000 units a day because you're not making any in the winter. Here's the things that prevent you from making vitamin D, because vitamin D is normally a reaction between the ultraviolet radiation from the sun and the cholesterol in your skin. One thing, they haven't proven that statin drugs can do that because statins lower your cholesterol level, but nobody's proven that vitamin D is depleted by statins. There's a little bit of evidence that statins might lower your vitamin D, but not very dependable. However, having older skin, you don't make much vitamin D anymore. Having dark skin, wearing a sunscreen, not going outside. I have Irish skin. I can't sit in the sun for 15 minutes. I will fry. I have to take a supplement. But I really think most people would get value from taking a supplement. So I'm getting 2,000 units. I take a product called Immunity HX, which has zinc, vitamin C, and vitamin D because they're all needed for the immune system. And then I get my multivitamin, which has an additional 400 units. And that's pretty good. I have some yogurt. I have a little bit of dairy, so I'm getting a little bit more there. And I eat my vegetables. You make a little bit of the ergocalciferol when you eat vegetables, because I take a probiotic, so I know the probiotic, good bacteria, interact with vegetables, and they make vitamin D2, so I know I'm getting some of that also. So I think I'm covered. But safely in the winter, you could take 4,000 units. In the summer, I would still take over 2,000. I would still take about 2,400, 2,500 units a day. So thanks for tuning into the InVet Health Podcast. You can find all of our episodes for free wherever you listen to podcasts. Or once again, just go to my website, invethealth.com, the loading page, scroll down about halfway, and on the right side, you'll see an icon for podcast. And click that, and you'll see them all. Please subscribe. Please leave me a review. I would really like to know how I'm doing. You can follow us. Invite Health on Facebook, Twitter, and Instagram at Invite Health. And I hope to see you another time on another episode of the Invite Health podcast. Thank you for listening.